Hi, can you tell us your name, your role, and how long you've been in your current position?
Yeah, my name is Bill Hayes. I'm the Air Quality Coordinator at Boulder County Public Health. Been with Boulder County Public Health for 19 years, most of that time with business sustainability work, but for the past 5 years in air quality.
And what is public health's role in an emergency response?
Public health boards of health also need to be prepared to issue emergency declarations. And again, just like the messaging that we should have available on hand before a disaster, those declarations need to be essentially, ready to fill in dates and more details, but to move quickly so that they can mobilize their full authority under state law to respond to a disaster. And that can include pulling in funding. It can put rules in effect to protect public health and public safety.
So the declaration really is the first step to allow all those other things to start happening.
Right. There are many things that public health can do on a disaster response and recovery without that declaration, but sometimes a declaration is necessary, and the boards should be ready to issue that. We have two roles, one during the actual emergency itself, and then a larger part typically in the recovery after the disaster. So during the response effort, we may be making sure that shelters are stood up so that we can evacuate people. But after any disaster, especially a fire or a flood, we have food safety issues to worry about, making sure that restaurants and grocery stores are getting rid of any food that spoiled or was contaminated, getting those back up and operational so that people have access to clean, safe food, making sure that our water systems and our sewage systems are properly functioning. Myself, I work in air quality, and so we're looking to see if the wildfire smoke is impacting air quality for our residents. And then after any disaster of that type, we've got a large amount of hazardous materials, hazardous wastes that we need to help the public properly dispose of.
What role did Boulder Public Health play in the Marshall Fire response, and yours in particular, especially when we know what an unprecedented fire it was?
Yeah. And so during an emergency response, typically because of my background, I get put in the safety officer box. And so I'm making sure that whatever actions county and public health staff are taking to respond to a fire, that they're not putting themselves in danger during that time. In most disasters, the response time is longer than what we had for the Marshall Fire. The Marshall Fire, ignited on Thursday, December the 30th, and 24 hours later, with the help of snowfall, it was extinguished. And so typically in a wildfire situation, we have days, weeks, sometimes even months of the response. And at that time, we're able to plan our recovery effort. But the Marshall Fire, we essentially had 24 hours to start mobilizing our response because, just days after the fire, there were thousands of people that were evacuated that wanted to get back into their homes that hadn't been burned, but were still significantly impacted by the fire, either smoke damage or they didn't have power. And we had in the city of Louisville and the town of Superior, both of their drinking water supplies were shut down for a couple of weeks. And so we had to get messaging out very quickly and to help people get back into their homes and start that recovery process. And additionally, the Marshall Fire was so unprecedented that the plans and messaging that we had in place in many cases were not adequate. And so we were working very quickly to develop new answers to questions that we'd never received before.
Yeah. What about during the fire while it was still happening, and what was public health's role in medical and protection of life support?
Yeah, during the fire itself, we had a Vista hospital, a mid-sized hospital, but it had to be fully evacuated. And so that meant transporting hundreds of patients, some of them, that were in intensive critical care, and the ability to mobilize and move those patients, and there were no fatalities, which was, we're very thankful for, and actually, pretty amazing. The fire burned right up to the hospital, and in fact, their oxygen storage tanks were at risk of burning, and had those caught fire, we would have had a significant issue. It probably would have closed down the hospital for quite a while. In addition, we've got a number of healthcare facilities, nursing homes, retirement communities that we also had to evacuate a large number of people from. And we're fortunate in Boulder County because we have relationships with our hospitals, with those healthcare facilities. So, we know who to pick up the phone and who to call. They know to call us, and we already had plans in place. We had trained with these facilities for this event in the past. And so that helped all of that go smoothly and, again, avoid any fatalities.
Yeah, that's amazing. Talk a little bit more about the relationships and the things that were already in place that helped with the response to the Marshall Fire.
Yeah. Well, in Boulder County, we have, I think, a very good emergency operations management center that coordinates resources from all of the municipalities within Boulder County. And that group meets regularly, trains regularly. So it's not just Boulder County that's responding, it's all of the municipalities, whether they were impacted by the fire or not. Other municipalities were lending aid to those impacted directly by the fire.
What did the community already have in place as far as relationships or other structures that helped with the Marshall Fire response?
In Boulder County, we have a very robust emergency operations management team, and they coordinate fire and rescue, police, ambulance services from all of the municipalities within the county. So it's not just Boulder County responding. And so you had cities that were not directly impacted by the fire providing aid to those municipalities that were impacted. Additionally, thanks to COVID, we have built some other additional strong relationships that came into play during the Marshall Fire recovery, most notably with the Boulder Valley School District. They had 9 schools in the burn area that were impacted by the fire, and we had been working with them since the start of COVID. When COVID first became an issue that we had to address, we were working with schools to upgrade their cleaning practices, upgrade their ventilation systems to reduce the transmission of COVID. And those same systems aided very well in them being able to start classes back up after the winter break on time, with full assurances for the students and for the parents that the children were going to be in a healthy environment. Additionally, we put air monitors, exterior air monitors on all of those schools so that parents could go to a website and in real time see what the air quality at those schools were.
Yeah, so having those previous relationships with schools was really helpful. What about with other parts of the community, like the labs in Boulder County?
We're very fortunate in Boulder County that, we do have a number of the national labs, and we have the University of Colorado. And so, within days after the fire, NOAA, the National Oceanic and Atmospheric Administration, called us up, let us know that they had a van packed with air monitoring equipment. We were able to stand up a particulate air monitoring system pretty quickly, but VOCs were perhaps a larger concern immediately after the fire. And so NOAA was able to drive their van through every single road in the burn area, and we sampled for a very wide range of gaseous pollutants, primarily focused on benzene as kind of our indicator contaminant. And what we found, was really reassuring. And they took a massive amount of data and compiled it to a simple answer that the air quality was no worse than typical urban pollution. And that, put a lot of people's minds at ease. Then a couple weeks later, they came back and drove the van through all the roads again, and we were able to see that all of those pollutant levels had decreased significantly. So that relationship was really vital for understanding our outdoor air quality concerns. But we also had indoor air quality concerns as thousands of people were returning to homes that were heavily impacted by smoke. And so we had researchers from the University of Colorado that went into a few of these homes to identify, what was the air quality. And then they tested several different mitigation systems to see which was most effective at improving that indoor air quality. So it was starting as simply as just opening the windows, turning on fans, using the home central air system, and then putting HEPA filters in. And they were able to show that a simple HEPA filter was very effective at reducing those indoor air pollutants. And the moment that they turned those HEPA filters off, those pollutant levels went back up. After about 6 weeks, most of the pollutants got down to a baseline level, and we weren't able to distinguish levels of pollutants in those homes different from homes outside of the burn area. So again, that was very reassuring to people wanting to get back into their homes. There were still other issues and health risks and concerns that those people had to deal with. But from an indoor air quality standpoint, that gave us a lot of valuable information. They also monitored during remediation cleanup efforts. So when the professionals came in to clean a home, they would identify whether those practices were helpful or not. And in some cases, because the cleanup teams were using very aggressive chemicals with VOCs, they actually temporarily made the air quality worse. So again, just really valuable information that we never would have been able to have accumulated on our own. And those partnerships now are going to be ongoing, and we're looking at a number of other issues that may become, emergency responses in the future.
And some of those relationships are available to people across the state, right, through NOAA?
Yes, certainly, we're fortunate that, most of the researchers at NOAA and NCAR and the CU professors are also our neighbors. But, the University of Colorado is a state university, and they are national labs. And I'm confident that if any municipality in Colorado were to contact them and ask, that they would try to provide, similar levels of support.
What would you say public health generally, and especially Boulder County Public Health, is looking towards to be prepared for the next emergency?
Well, we're always learning from the previous disaster and improving our plans, and practicing those plans is what's most important. You can't just write your response plan, put it on the shelf, and hope that just dust it off at the next emergency. And so we do have tabletop exercises. We have field exercises annually on the types of disasters that we expect to see in Boulder County. We also have all of our public health staff trained in the Incident Command System, ICS, and that was what was developed by National Wildland firefighters to respond to those types of disasters. And so that's pretty standard for police and fire now, to follow this structure that creates a chain of command and a reporting system and very clearly identifies duties of everyone working on the response. And so we have all of our Boulder County public health staff trained to the ICS system, so that when a disaster does occur, we've got all of our staff available to help with that response, instead of just putting a few individuals in there that will get, quickly exhausted and overwhelmed.
Yeah.
When an emergency breaks out, you can't have just a few key personnel in the emergency response center 24 hours a day for weeks on end. That you've got to make sure that you're giving people the rest that they need so that they can function properly at a high level when you need them. So making sure that you have depth in your resources for emergency response, making sure that you're on top of that, and scheduling and turning over. A lot of times in a response, there are some people that, don't want to go home and take a break because, this is important, vital, critical work. But, sometimes you have to step up and tell them, please take a break.
Right.
And, I've gotten that talk and I've appreciated it.
Yeah.
So.
Yeah, so training staff is a really big part of it. How else are you looking towards or currently taking care of staff, knowing that this fire was a huge emotional toll in the middle of COVID, which was a huge emotional toll?
Well, it's unfortunate that we've kind of gotten to the point of, well, we'll get to that when we're no longer in a disaster recovery mode, because it's pretty much been 2.5 years of disaster recovery. COVID, we stood up the incident command system just like we would for a natural disaster. And then this summer, after things were calming down from the Marshall Fire, we threw in monkeypox. So it's always seems like, for the last 2.5 years, we've always been in recovery mode. And that's really stressful for staff, not just from increased workloads, but it takes a mental toll. And, COVID, we've lost a number of staff just due to burnout and stress from COVID. And when the fire started, again, not just the number of hours, but when you go out and you see entire neighborhoods reduced to blackened foundations, that really takes an emotional toll. And so Boulder County Public Health, I think, has done a very good job of standing up mental health services to help employees deal with those stresses. Boulder County for many years has had an emergency assistance program that offers up to 8 free counseling sessions with therapists. The system's set up that if you've got a problem, you make a phone call and they get you set up with a counselor in pretty short order. So we've always had that available. But since the fire, we've started having weekly check-in meetings where people can come speak to a physician trained in mental health response, and they change up the topics each week. And we've been looking for, kind of other recreational outlets outside of work, trying to get staff meetings that, we're not talking about work, but we're really checking in with each other. How are you doing?
Right.
And I think, it's important for all the supervisors in public health to be meeting with their staff regularly and not just seeing how is the work going, but how are you doing?
Right, going back to the importance of relationships.
Yep.
What advice do you have for other counties that may, unfortunately, but realistically, have to deal with an emergency response?
Yeah. First off is making sure that you have those emergency response plans and, as I said, training to those plans. And we've said relationships several times, and that's really the next important step, is building the relationships with the entities that you're going to be working with on a disaster response. So, from a public health standpoint, we're having good relationships with all the healthcare facilities in your county, with all the child care facilities, with the school districts, with the police, with the fire and rescue departments. And then, reaching out broader, there are a number of state and national organizations that are, thinking about these same things, so that you're not having to start from zero and reinvent the wheel. As I said, Boulder County Public Health, we have, I think, very robust emergency response plans that we're more than happy to share with anyone.
What other tips or what else do you think it's important for people to know about emergency response?
Well, we know that climate change is exacerbating all of these natural disasters, to the point that we're no longer even calling them natural disasters. They are, in a sense, man-made when we have wildfires like the Marshall Fire, when we have flooding like Boulder had in 2013. And so recognizing that such events are going to be more frequent and more severe. And especially in the fire part, one particular thing we're seeing is an increase in the urban wildlife interface. And what that means is that we've got residential areas butting right up against open space, state and national forests. And so that allows what would be a forest fire to quickly become an urban fire. And so being aware of when we build, how we make those spaces defensible and how we put up breaks between wildlife and the residents. And that can be difficult because a lot of people love living in Colorado, move to Colorado to be close to the wilderness. But we have to be smart in how we do that and identify where those interfaces are and have plans to protect.
Well, thank you so much. I really appreciate talking with you and hearing more about your experience with the Marshall Fire. So thanks for joining us today.
It's been my pleasure. Thank you.